Winter holidays and alcohol consumption are culturally intertwined in many societies. Holiday parties, warming drinks, celebratory toasts, these seem like harmless traditions. But the combination of alcohol and cold weather creates physiological interactions that significantly increase cardiovascular risk, particularly for a phenomenon called holiday heart syndrome. Understanding these interactions doesn't require abstinence necessarily, but it does require awareness and moderation that many people currently lack. Alcohol's cardiovascular effects are complex and seemingly contradictory. Initially, alcohol causes vasodilation. Your blood vessels relax and expand. This creates a sensation of warmth, which is why alcohol has been traditionally viewed as warming. But this warmth is deceptive and dangerous. The vasodilation brings blood to your skin surface, where heat radiates away quickly in cold environments. Your core temperature actually drops faster when you're intoxicated in cold weather than when you're sober. This is how people die from hypothermia after drinking outdoors. They feel warm while they're actually losing critical heat. Simultaneously, alcohol impairs your thermoregulation mechanisms. The shivering response, which generates heat through muscle activity, becomes suppressed. Your judgment becomes impaired, so you underestimate how cold you are and make poor decisions about clothing and shelter. You might stay outdoors longer than safe, or fail to recognize early signs of hypothermia. This combination of increased heat loss, impaired heat generation, and poor decision-making creates serious hypothermia risk during winter alcohol consumption. Holiday heart syndrome refers to cardiac arrhythmias, particularly atrial fibrillation, triggered by alcohol consumption. This was first described in people presenting to emergency rooms with irregular heartbeats after holiday parties. Alcohol directly affects the electrical conduction system of the heart and can trigger abnormal rhythms even in people with no underlying heart disease. When this happens in winter, with the additional stresses of cold exposure, dehydration, and blood viscosity changes, the arrhythmia becomes more likely to trigger stroke. Atrial fibrillation allows blood to pool and clot in the heart's upper chambers. If those clots break free and travel to the brain, the result is stroke. Alcohol also dehydrates, exacerbating the winter dehydration we discussed earlier. It increases blood pressure paradoxically after the initial lowering effect wears off. For people on cardiovascular medications, alcohol can interact dangerously, either potentiating effects to dangerous levels or interfering with the medication's protective benefits. Many cardiac medications specifically carry warnings about alcohol consumption, warnings that people often ignore, particularly during holidays. Does this mean complete abstinence during winter? Not necessarily, but it demands thoughtful harm reduction. If you're drinking alcohol in winter, stay indoors in climate-controlled environments. Never drink before or during outdoor winter activities. Stay aggressively hydrated with water between alcoholic drinks. Limit consumption to moderate levels, which means significantly less than many people consume at parties. Be aware that the combination of alcohol and cold weather affects your judgment, so make decisions about transportation and outdoor exposure before you start drinking. For anyone with cardiovascular disease or risk factors, discussing alcohol consumption with their cardiologist can provide personalized guidance. But the general principle is that winter requires more caution than summer regarding alcohol and cardiovascular health.